Hello friends, today we are going to discuss about COVID grief counseling in child and adolescent population. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at Nimans, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. If you want to have a clinical opinion, please do contact child and adolescent psychiatrist. Conflict of interest? None. Child and adolescents population. They are highly resilient, but at the same time vulnerable also. They become resilient when the effect of protective factors outweigh the risk factors. That means, if the protective factors are more, they will be having less of psychopathological issues. Whereas if the risk factors are more, they develop various psychiatric issues. Let's look into the various protective factors. Supportive environment, stable relationship with friends, family members, with relatives, and other stakeholders of the society. Being connected to the society, having a good self-esteem, socioeconomic status, warm parenting, good peer support, and good physical health. All of these play a role in protecting them. Whereas there are some risk factors like broken family, environmental adversities like disaster, war, maybe various other environmental problems, mental illness, abuse, especially sexual abuse, domestic violence, substance use. These are the risk factors. So, any of these, either the protective factors or the risk factors, whichever outweighs, that results in the development of psychiatric illness. Let's understand how the child and adolescent population react to grief. Grief in children. Talking about dying and death with children is very difficult, and it is not easy. Every adult finds it very difficult to communicate about bad news, especially regarding death. It is like a mammoth task. Whenever caregiver is himself or herself struggling or dealing with the grief, then usually children are neglected. For example, if an adult in the family has expired, the other adults will be grieving. Invariably, children will be neglected. Processing of grief in child and adolescent population is directly dependent upon their cognitive development. If the child is less than 3 years, they will not be able to comprehend what is going on. In preschool children, that is less than 6 years old, they feel the person who's died is playing hide and seek kind of game. They feel the death is temporary and he will come back. It's just like watching the cartoon. Whereas the children above 6 years, they behave like adult. That means they are able to understand that death means it is permanent. So, the grief processing is directly dependent upon cognitive development of the children. Let's understand how the grief symptoms are manifested in children and adolescent population. The above 6-year-old, the children will have irritability, anger, bullying other children, regression of milestones, bedwetting, clinging behavior, crying most of the time, boisterous play, nightmares, unreasonable demands, withdrawn behavior. At the same time, you can also see loss of interest, sadness, fearfulness, guilt feeling. This is one of the commonest I have seen in children. They feel that they are responsible for the death of their parent. This needs to be addressed and inquire in every child and adolescent population. Insomnia, poor appetite, academic decline, avoiding friends, avoiding playtime, being alone, and imitating the dead person. So these are the various grief symptoms can be seen in child and adolescent population. Let's understand grief. Each child's response to grief is unique, complex, and personal to the child. Grief counseling in child and adolescents. Let's move into the important topic now. What is that grief which is unique in COVID? Death occurs in isolation, which is rapid and unexpected. The minimal rituals are carried out because of the COVID protocol of funeral, not able to see the face of the loved one who has expired. Social and relative distancing prohibits the conducting of ceremonies, especially the death rituals, not able to say goodbye properly, no dignified burial, social stigma and discrimination. If a person has died, that family will be ostracized from the society for a time being. At the same time, the survival guilt, being helplessness, I could not do anything for my dad's death or my mother's death. They may also feel that I am the reason I have carried the infection to my dad or to the mother. I am responsible for the death of them. I can't be pardoned. So these kinds of self-blame are common in children. At the same time, they also start imagining what may be the way they died. How would I have been the last moments? At the same time, conflict with deceased. Sometimes with the COVID protocol, if the parents would have insisted to wear the mask, not to go out, the child or the adolescent would have not listened to them. Now, because of them, if the infection had carried to their parents, they will carry that guilt. Fight with the deceased before and during hospitalization is another big issue which revolves around the grief in child and adolescent population. Fear of getting infected and dying is another essential, especially in adolescent population. At the same time, fear of death of other family members. At the same time, pre-COVID status between the relationship between the person who is deceased and the child and adolescent population also needs to be explored. Let's move into the grief counseling. Breaking bad news is a very essential. Many a time, children and adolescent may not know the person has expired. Hence, they need to be informed. They need to be provided with all straightforward answers without giving circumstantial answers. They need to be told that your dad has died because of COVID, or he is dead, or he is killed by COVID. So give them honest answer. Do not be circumstantial. Do not tell that that person passed away, which that may give a different meaning to them. Hence, being straightforward, honest is very essential in children and adolescent. Give the child the choice of whether to participate in the funeral or in the rituals. Nowadays, there are various virtual rituals can be organized. And nowadays, children and adolescents are very good with virtual platform. They themselves can play an important role in organizing this virtual funeral. Allow them to join the funeral. Don't stop them. If they want to participate, please welcome them. If they do not want to participate, do not force them. Virtual funeral services are essential, especially with adolescents, because they need to say goodbye to the loved ones. Otherwise, that will have a pathoplastic effect on their personality over a period of time. Don't avoid talking about the deceased, because many a time the elders in the family may say the person who has died need not be discussed, need not be brought into discussion, so that the child will be affected. In fact, the more you avoid, the more it affects the children. The more you are going to discuss about the emotions, about the feelings, about that person, makes it, normalizes it. So this normalization of the grief process is very essential. So as and when possible, bring about the person's discussion in the usual meeting in the home. At the same time, goodbye letter can be written. Many a time, children and adolescents may not be able to express. Ask them to write a letter to the person who has deceased. That letter may not be posted. The person, especially the child or the adolescent, may write whatever the feeling which is there inside can be put on the paper. That emoting is very essential. At the same time, completing it will also help them to say their goodbyes to the deceased in a constructive manner is essential. Suppose the child feels that he or she is responsible for the death, that can be seen in the goodbye letter. At the same time, the grief sentence completion can also be planned. For example, if the person has deceased, after 2 or 3 days down the line, when they are having breakfast, they can bring in, if your dad was here, ask them to complete the sentence. So they may say, my dad would have not liked this food, or he would have liked the breakfast. So it gives an opportunity to reflect their emotion, at the same time share their feelings with related to the loss. So sometimes these kinds of filling the situation is very essential to bring in the hidden emotions and also feelings of the children. Sharing of emotions. The adults in the family should share their feelings with the children, because by sharing those feelings, the child also realizes it is normal to cry, it is normal to grieve, it is normal to show angry. So these kinds of sharing of feelings of adults with the children normalizes to a larger extent. So that kind of experience need to be shared with the child and adolescent. At the same time, watch your words when you're talking to children. Don't say, don't cry, you are strong, don't be sissy, don't be a child, be a good girl, now you are the responsible person in the family. Don't do such words. Everyone is human, and for every loss there is a grief, and to overcome grief, everyone needs to grieve. Coming to the circumstances about the death, if the child and adolescent would like to discuss, please discuss about what happened, how it happened, when it happened, and what may be the circumstances. So those discussion about the death related issues can be discussed with the children and adolescent. At the same time, facilitate ventilation. Allow them to express their emotions. Active listening and supportive work is very essential. Inquiring about the emotions, paraphrasing, telling that, okay, you seems to be angry. I heard that you were very angry with your dad before his death. So these kinds of words and exploring is essential to know the child's feeling. At the same time, normalizing the emotions at whatever possible way and validating the emotions is essential. If the child says, I'm fearful, so you need to explore and has to say, yes, of course, everyone will be fearful during this time. Your dad has died because of COVID, and I am also worried I may also die because of COVID. So these kinds of validation of emotion is essential so that they know that everybody is scared, everybody is anxious, and it is normal to be scared. That is one important message has to be driven. At the same time, symbolic rituals need to be carried out. Just like putting the photo and grieving in front of the photograph also matters. Allowing them to talk about the loss with the closed one is also essential. Invite the family members to share the stories and special memories and codes with regard to the person who has passed away. Open chair technique is very essential. Ask the child and adolescent, talk to a chair, open chair. That means there is nobody on that chair, but imagining as if the person who is deceased is sitting there, the child and adolescent population need to talk to that chair, telling that whatever the feeling is there, if they want to say sorry to the person deceased, that can be conveyed. At the same time, similarly, extending one step further, role play can be done. Initially, the child and adolescent will enact as if the person is sitting there who is deceased, and they will communicate with them. At the same time, role reversal occur. If his father was sitting there on the other side, what he would have said, that they need to become the person who has deceased and act. So that means they will be able to say sorry. At the same time, the father would have forgiven him. So those kinds of grieving process need to be carried out. At the same time, using photo albums, videos of the deceased, discussion about the photos, discussion about the videos play a very essential role in normalizing the grieving process. Writing the letter to the deceased, sending some greeting cards, using art of expression, those kinds can be used, like painting, maybe rangoli painting. So various kinds of innovative methods can be brought in where the child and adolescent can express their feeling through arts. At the same time, you need to provide multiple opportunities to grieve. It should not be one or two opportunities. The children and adolescents give their emotion or express their emotion in installments. Hence, you need to provide multiple opportunities to grieve. And at the same time, one need to continue to express their feeling. Keep the photograph, talk about the photograph, talk about the deceased, continue to tell stories, share the memories of the deceased. At the same time, try to make time to grieve together. Grieving together helps. Drawing color pictures of the loved one who has passed away and identifying what they will miss most about that individual is also essential. Sometimes creating scrapbook of their favorite memories with their loved ones plays a very essential role. The scrapbook is one of the important way which I have found out, where the child and adolescent can be told to cut the photographs, paste it, they can write their feelings in that scrapbook, and also express their feelings, what happens to them. So at the same time, the child wants to share the happiness. If he had won some prize, if he is very sad, that can be a closed space where the child can communicate with the deceased. To conclude, my dear friends, the grieving process in child and adolescent is very different. But however, it is not difficult to facilitate this. There are some do's and don'ts. First and the foremost, if you are a family member or a counselor, please learn to know active listening, allowing them to express emotion. Normalize the emotions what the child and adolescent population are going through. Validate the survivor's feeling. At the same time, encourage the grieving process by symbolic rituals. Grieve with the family and other relatives, because do not keep the children away from the grieving process. Many a time in the grieving process, the adults also, when they are grieving, they may forget the children. That should not happen. Structure the daily activities of the children whenever there is a grief stricken in the family. There are very important don'ts. Do not block the emotions of the children by saying, "Stop crying, be strong." Those kinds of words should not be used. The children are also human beings. They need to grieve. Hence, allow them to grieve. Don't say, "Forget about the deceased." That is simply impossible. The person who has died may, as a physical person, would have moved out of our life. But the thoughts regarding that person, emotions regarding that person linger in the mind till our death. So don't say that forget about the deceased. That may harm to the child more. At the same time, don't say stop talking about the person who has died. Don't do that. More they talk about the deceased person over a period of time, it loses its emotions with regard to grief. So the person overcomes the grief and is able to deal with the memories and feelings regarding the deceased person. And don't avoid discussion with regard to the deceased person. Please do facilitate grieving process in multiple environment, multiple opportunities to be given. The only cure for grief is grieving. Thank you very much for giving your valuable time. Stay safe.